Good evening and welcome to our educational webinar on Lapiplasty 3D Bunion Correction. We appreciate you joining us. I'm Kendall Rock, Social Media Specialist at Treese Medical Concepts. Treese Medical is the company who patented the Lapiplasty procedure and manufactures its instrumentation and implants. Our goal here tonight is to provide you with quality information because we know that making a surgical decision is a decision that isn't taken lightly. We applaud you for empowering yourselves with information to make the best informed treatment decision you can. I will quickly get a couple of housekeeping items out of the way so we can get right into the presentation by our surgeon speaker, Dr. Jeremy Dublon of Potomac, Maryland. First of all, you are listening to the webinar on mute, but you can ask questions throughout by clicking on the questions tab in your control bar and typing them in. We'll be answering questions sprinkled throughout the presentation and at its end. We'll also be emailing you an archived link of this presentation to refer back to within just a few days. Lastly, I know that you will enjoy our speaker, Dr. Dublon, but if you are attending outside of Maryland, you can find locally trained Lapiplasty doctors in your own area to consult with by visiting our patient website, www.lapiplasty.com. There's a prominent Find a Doctor button at the top of the homepage, searchable by zip code. With all that out of the way, I'd like to introduce you to tonight's surgeon speaker, Dr. Dublon. Hailing from Brooklyn, New York, and shaped by immigrant roots, Dr. Dublon's journey is a testament to his remarkable dedication and credentials. A graduate of the University of Scranton with a degree in neuroscience, Dr. Dublon pursued his podiatric passion at the New York College of Podiatric Medicine. His commitment extended to the United States Army, where he served as a surgical podiatrist from 2018 to 2022. Notably, he rose to the position of Deputy Service Chief at Walter Reed National Military Medical Center, leading the podiatry department and advising the White House as a medical consultant and surgeon to the president. Board certified with a specialization in sports medicine, thanks to his military service, Dr. Dublon's expertise continued to flourish. Post-military, he contributed his skills as a medical officer at the Food and Drug Administration until 2023, offering invaluable insights into regulatory and commercialization pathways for orthopedic innovations. This unique background enables him to provide state-of-the-art technology to his patients. Dr. Dublon's professional accolades include being a diplomat of the American Board of Podiatric Medicine and a fellow of the American College of Podiatric Medicine. He has authorized publications on talar osteochondral defects and post-operative pain management through peripheral nerve stimulation. His dynamic presentations have covered diverse podiatric topics from biomechanics to sports medicine. We appreciate Dr. Dublon volunteering his time tonight. I will return to moderate a question and answer segment at the end. And now, Dr. Dublon.
Thank you, Kendall. Thanks for the great introduction. So I'll jump into this PowerPoint. So the Lapiplasty system was cleared by the FDA since 2015. It is not an investigational device. The procedure is patented. It is manufactured by Treese Medical Concepts. It requires advanced training and is not offered by all surgeons. Over 100,000 patients have been treated. It is covered by most insurances. Medicare will cover the cost, and coverage can vary, but you must check with your provider. Find trained surgeons at www.lapiplasty.com. Now let's get into it. So some potential adverse events. As with any surgery, there can always be infection, adverse reactions of a foreign body, to include stainless steel or titanium, pain, discomfort, or abnormal sensations due to the presence of the implant. There can be loosening, bending, cracking, or fracture of the components, as well as loss of fixation of bone attributable to non-union, osteoporosis, markedly unstable comminuted fractures, loss of anatomic position with non-union or malunion with rotation or angulation. Additionally, there could be migration of the implant, loosening of the implant, delayed correction in alignment, decrease in bone density due to stress shielding, and the development of bursitis. Bunions. Bunions are more than a bump. Typically, symptoms include pain, swelling, pressure, and numbness, and it gets worse as the toes are crowded or if the patient stands for a long time. A misconception is that a bunion is an overgrowth of a bone that can be quote unquote shaved off. In actuality, the root cause of the bunion is an unstable joint seen in this diagram. You can see it with a larger red arrow, and that's the metatarsal cuneiform joint. As there's a deviation in that bone, a bump presents on the inside of the foot. In reality, there's a complex deformity, as stated previously. They're caused by an unstable joint in the middle of the foot, which allows the bone to drift out of alignment towards the midline of the body. While constrained footwear or standing for long periods of time may aggravate or accelerate your condition, your bunion is more likely caused by, number one, genetic predisposition, and number two, biomechanical imbalance. On the picture on the right, you can see a diagram of the sesamoids, which are the two bones on the bottom of the big toe joint, quite similar to the patella in your knee, and act as a fulcrum for the tendons and the muscles that bring your toe down. The metatarsal bone is the long bone that is the root cause of the bunion, and the unstable joint is the area that we're treating, and that is the area of our focus for this procedure. So if you can look at the diagram on the right, the longest arrow closest to the bottom of the screen is where we do the procedure for Lapiplasty. So bunion treatments. Traditionally, for decades, there was a two-dimensional osteotomy. We simply shifted the bone, or the head of the metatarsal, towards the other toes. So it is a commonly used procedure for bunions. However, it's only a two-dimensional treatment. Non-surgical and conservative treatments tend to include, but are not limited to, toe spacers, pads and splints, inserts, and orthotics. The root problem is not corrected, you're simply managing the deformity. Lapiplasty. It is a three-dimensional correction, and how it works is that the entire bone is returned to normal alignment. Natural anatomy is returned, and a straight toe is rotated back into position in a three-dimensional correction. Questions. How do you determine if a patient is a good candidate for the Lapiplasty procedure? Prospective patients are recommended to book a consultation with a surgeon that offers Lapiplasty 3D bunion correction. During a consultation, x-rays may be taken to help determine if the patients may be a candidate. Typically in my practice, I will include the standard 3-view x-rays and add a fourth x-ray that allows me to view those sesamoids that we spoke about earlier. Viewing those sesamoids in a sesamoid axial view can help determine a rotation deformity, part of the 3 dimensions, that may be present in your bunion. My bunion is moderate. Next question. My bunion is moderate to severe. Is there a bunion that is so severe that it can't be treated? The Lapiplasty procedure treats bunions of all severities, mild, moderate, and severe. However, a surgeon will speak to what treatment plan is best for you. Next question. Can I get a Lapiplasty procedure if I have already had previous bunion surgery? The answer is yes. It is possible for the Lapiplasty procedure to be utilized to correct a failed surgery. However, it will be necessary to go to a Lapiplasty doctor for a consultation. Again, the doctor will need to evaluate your foot to absolutely determine if you are a candidate for the procedure based on your unique set of circumstances. Now, in my practice, those unique set of circumstances don't just include what is presented to me from an x-ray or a clinical standpoint. Those unique circumstances include what the patient's goals are in terms of activity, returning to work, and future events such as potential marathons or hiking trips. How is Lapiplasty procedure different? Well, as mentioned previously, it corrects in all 3 dimensions. It does not simply cut and shift the bone. It addresses the root of bunions at the first metatarsal joint, which is the unstable joint, and typically gets you back on your feet in a walking boot 3 to 7 days after surgery. Bunions. What may happen if I don't treat my bunion? As bunions progress, they obviously get worse. However, that deviation of the toe leads to arthritis within the first metatarsal phalangeal joint or the big toe joint. And as you can see, that drift towards the pinky toe can now impact your second toes. So that's what we call a crossover toe. You can additionally develop hammer toes, bone spurs, and pain in the ball of your foot, known as metatarsalgia. Bunions are a progressive disorder. They do not go away on their own. And the quicker that you go to see a Lapiplasty surgeon for consultation, the better potential for success you will have. So some results. On the left, you can see a 7-week post-op, a reduction in the bunion deformity. Of note, you can see that the tissue or the skin around the bunion deformity is no longer red from pressure in a shoe. The next set of pictures you can see in the middle, that's 12 weeks post-op. The incision has healed nicely, and again, the bunion deformity is reduced. Finally, all the way to the right, you can see a 6-month post-op of a Lapiplasty procedure with a significant reduction in bunion deformity, correct alignment of the big toe joint, and minimal scarring. What is interesting to note is that on all 3 of these patients preoperatively, there is a frontal plane rotation where the left side of the big toenail is closer to the ground and the right side of the big toenail closest to the second is up, demonstrating a frontal plane or rotational deformity to the bunion. So recovery, a typical recovery timeline is detailed below. However, time points and doctor's orders vary based on each patient's condition. Be sure to ask your doctor what your typical recovery protocol will look like. Most often, within 2 weeks, the patient will put their foot down in a cam boot or a walking boot. For the next 4 to 6 weeks, the patient will walk minimally at first, increasing to tolerance. And by 6 to 8 weeks, they are back in a sneaker walking. Some of my patients have progressed to running at about 3 months, but most patients resume physical activity to include running at about 4 to 6 months. So let's talk about insurance. Is the Lapiplasty procedure covered by insurance? Most times, yes. What about Medicare? Yes, Medicare will cover the procedure when the procedure is deemed medically necessary by your provider. Insurance and Medicare typically cover the bunionectomy and joint fusion procedures that utilize the Lapiplasty system. If your doctor determines that the Lapiplasty procedure is right for you, he or she can reach out to your insurer to determine the specific level of coverage. Any questions?
Thank you very much, Dr. Dublon. We've had several questions come in this evening. Thank you for the great audience participation. We'll do our best to answer most, if not all, of the submitted questions now. If you haven't yet, as a reminder, you may ask a question by clicking on the questions tab in your control bar and typing it in for us to see. Before I turn your questions over to the doctor, I'll start by answering a quick question that has come in repetitively during the presentation. So one of the questions that has come through is the Lapiplasty procedure covered by insurance and or Medicaid? The answer is yes. When the procedure is deemed medically necessary, insurance and Medicare typically cover the bunionectomy and joint fusion procedures that utilize the Lapiplasty system. If your doctor determines that the Lapiplasty procedure is right for you, he or she can reach out to your insurer to determine your specific level of coverage. All right, so let's get into it. One of the questions that has come up repetitively during this presentation, Dr. Dublon, is what does the typical Lapiplasty procedure recovery look like?
Yeah, that's a great question. So I like to answer this to my patient. I like to go over this with my patients kind of in a stepwise fashion. So the first phase of healing will be the skin, right? My most pressing concern right after surgery is making sure that the skin is healing nicely to reduce the formation of scars, and also obviously to make sure that we can get the patient up on their foot. The skin typically closes in about 2 weeks. In my practice, the patients do not bear weight until about 12 to 14 days after surgery. That allows the skin to stay without tension. So I put a pretty good amount of compression on there. The next phase is obviously the bone healing. So that's going to be over the next 8 weeks. I will protect the patient in a boot up until that 8-week mark. And once the x-rays, I'm comfortable with the x-rays, I will progress them into a shoe. To fully recover for walking, you can expect to walk relatively pain-free at about 4 months, 3 to 4 months. I have had patients walking a lot sooner than that, and I have had patients walking with pain longer than that. But the average is about 3 months for walking. Running can range anywhere from 4 to 6 months, as mentioned previously. However, most of my patients that were runners prior to bunion surgery will get back to running within 6 months, depending upon the type of running they do. I tend to have my trail runners or high intensity runners that do sprinting or shorter distances. I keep them off that high impact for about 6 months. That's the soonest I'll let them go, but I will load them with an Alter G or a zero gravity treadmill. I hope that answers the question.
Yes, thank you. Another question that has come in regarding recovery is, will I need physical therapy, or do you recommend physical therapy after the Lapiplasty procedure to your patients?
Yeah, so I will say that I always recommend physical therapy. Part of that is to work on the limb that the patient is actually using more excessively now that they're not loading the operative limb, if that makes sense. So we don't want them to have an overuse injury on the limb that they're walking around with. So I do recommend physical therapy for that. That being said, my sequential step down from the non-weight bearing to the boot, then into the sneaker, without allowing for running, does allow the patient to get back on their foot sooner and negate the need for physical therapy. For specifically, they don't build up as much scar tissue or swelling because I'm getting them back to their native function a lot sooner. So yeah, that's my answer for PT.
Thank you. Another question that has come through is, do patients lose flexibility in their toes or feet after having the Lapiplasty procedure?
Yeah, that's a great question. So I can speak to my practice. I have a very long discussion with my patients regarding that bump. You know, when we do that 3-dimensional correction of the bunion deformity, we more often than not see a significant reduction in the size of the bump. That being said, if the bunion was there for some time, that tissue will be a lot thicker than native tissue, and it will be a little more swollen. So I have the discussion with my patient about visually how much the bump will bother them, even though it will be significantly reduced. Because if it is something that is visually important to them, I will go into that big toe joint and shave the bump down after I do my procedure and take out any excess tissue to kind of make that soft tissue in the skin look nice. That being said, that does increase the chance for stiffness in the joint. Anytime you enter a joint, you can develop some scar tissue, and that can end up limiting the range of motion after. So I have that discussion with the patient. I try to guide them towards not entering the first metatarsal phalangeal joint, the big toe joint, and simply allowing me to fix their bunion from the middle of their foot or the first tarsal metatarsal joint as we showed on the presentation.
Thank you. Another question that has come through is, will I be able to run after this procedure?
Yeah, so as I mentioned before, running is typically what I'm going for. That's how I guide quote unquote success for my athletic patients, the patients that were running before. You know, if you weren't a runner prior to Lapiplasty, I highly doubt Lapiplasty is going to make you a runner. But if you were previously a runner, you've developed bunion pain and you want to keep running, I have no doubt that you will be able to run following Lapiplasty.
Great, thank you. Another question that has come through is, if I have had a bunionectomy in the past, am I still an eligible candidate for this procedure?
Ooh, yes, well, it depends, okay? So there's over 100 different types of bunion procedures. If you had what we call a base procedure, if there was work done at or near where we plan to do our Lapiplasty procedure, you may not be a candidate. I would advise each and every patient that is interested in Lapiplasty to visit a Lapiplasty surgeon, get evaluated, and see if they are a candidate.
Great, thank you. Is there an age limit or an age requirement for this specific procedure?
We have seen patients have Lapiplasty done under 18. However, my preference is to do it over the age of 18 once the growth plates are closed, simply because a lot of the younger patients that we see with quote unquote bunion deformities are still growing through their growth phase and may grow out of that flat-footedness or bunion deformity. But you need to give the patient time to see if they can do it on their own. Otherwise, we can do it as soon as 18 in my practice.
And the Lapiplasty procedure is an outpatient procedure, correct?
Correct. It is typically performed in a surgery center or outpatient surgery center at a hospital. That being said, the trend now is that these procedures are getting done at surgery centers. Again, it's going to depend upon your insurance coverages. So as I said previously, I advise evaluation by a Lapiplasty surgeon so that they can run your insurance benefits and see your level of coverage.
Great, thank you. If a patient needs to have both their feet corrected, in your experience, how long do you advise in between having those surgeries done?
So that's a great question. If we understand that you have to load your non-operative foot to get around, you would inherently have to have that previous bunion surgery, not just 100%, but probably 150%. So in my practice, the soonest that I would put a patient under for the other foot is about 9 months. I have seen it done sooner. And again, that's going to have to be determined by you and your surgeon, but that's going to be based upon your A, level of activity, and B, as more important than not, your support system at home and during recovery.
Thank you. Can you go into greater detail about who would be an ideal or appropriate candidate for this specific procedure?
Yeah, that's a great question. So Lapiplasty, or more generally the Lapidus procedure, the fusion of the tarsal metatarsal joint, historically was performed on patients with significant bunion deformities. I will tell you that more recently my practice has changed, where I am doing Lapiplasty on patients who don't have as big of a bunion deformity, but may have a flattened foot attitude that I'm trying to prevent worsening, or they may have, first metatarsal phalangeal joint jamming or a functional hallux limitus due to that hypermobile first ray. So the ideal candidate would be somebody who A, has a bunion, but B, has a bunion that isn't simply pressure from a shoe. Okay, if you have joint pain, if you have pain at the midfoot, right, that is the ideal candidate. But again, I advise you to go to a Lapiplasty surgeon, get evaluated, and they will go over your entire file to tell you if you specifically are a candidate for Lapiplasty.
So in your opinion, can a bunion be too severe for the Lapiplasty procedure to correct?
That's a true question. So if it's a bunion, no. However, the end stage of a bunion, when you erode the cartilage at your big toe joint and develop arthritis, is what we call an arthritic joint or hallux rigidus, okay? At that point, it's difficult to say that the patient is a candidate for surgery. I liken it to the alignment on your car. Your big toe joint is the tire tread. The alignment is the bunion deformity. if you fix the alignment on your car after the tread on the tire is already worn, it does nothing for the tire. The tire is already worn. So that's how I look at the big toe joint. If it is out of alignment for so long that the cartilage is gone, the patient is no longer a candidate for bunion surgery because there's no big toe joint left. And they would then be a candidate for a fusion.
Thank you. Another question that has come through is, when will I be able to travel again, whether that is in a vehicle or by plane?
Right, right. So when we do have our patients in those cam boots, that is the soonest that I would allow my patient to go. So again, my biggest concern is the skin and the soft tissues. So the soonest I allow my patients to travel, whether it's a car or an airplane, because the foot is down, I don't want tension on that incision, and I don't want the foot to swell. So 2 weeks is the soonest that I would allow my patients to travel.
Great, thank you. Another question that has come through is, how long until I can get my foot wet or swim after having the Lapiplasty procedure?
So those are, to me, those are two different questions, right? Getting your foot wet, you don't have to put your foot down. But when you get in a pool, there's always a risk of you putting your foot down. So the answer to the first question is about 10 to 14 days once the skin is closed clinically and we either remove the sutures or just before we remove the sutures. And then for swimming, I really would like the patient to be in a sneaker before they do go swimming, simply because you never know what happens when you're by the pool.
Another question that has come through quite often is, if my feet do not currently hurt, should I have this procedure done?
If your feet don't hurt, should you have it done? No. So in my practice, we don't treat x-rays, we treat patients. That being said, you may be at risk of developing further deformity that you are unaware of, and I would advise evaluation, at least by a podiatrist, more specifically a Lapiplasty surgeon, to see if you're a candidate or in need of some sort of intervention.
Thank you. What is the level of pain and discomfort post-procedure look like, and what do you prescribe to your patients in order to combat the pain, if any, they are experiencing?
Yeah, so typically my patients will get a nerve block prior to the procedure. The nerve block is performed by the anesthesiologist. It is allowing the leg to be both numb and paralyzed from the knee down. Now, this is typically present about 7 to 10 hours after surgery, depending upon the drugs they use in the block. It can last 24 to 36 hours after surgery. I do like to augment with liposomal bupivacaine to allow for up to 72 hours of pain control. And then I have slowly started migrating away from opioids. However, with Lapiplasty, I do prescribe some opioids for breakthrough pain, but do advise my patients to use as needed or if not at all.
Thank you. Another question that has come through is, if I live in a 2-story house, how should I plan to get up the stairs? Can I walk up the stairs, or should I plan to stay on the first floor for some time?
Yeah, it's hard for me to answer that question. I like my patients to stay on the first floor if possible, at least for the first 2 weeks. Again, I'm more concerned about the skin and the swelling as opposed to the construct and the fusion or healing of the bone. So I would advise, if possible, to stay on the first floor. Again, if that's not possible, you would get a physical therapy consult prior to surgery to see and learn how to go up and down the stairs using crutches and not putting weight on that foot.
Great, thank you. This one kind of blends into the lines of talking about post-op recovery. If I live alone, do you recommend I have someone come stay with me post-surgery? If so, for how long?
Absolutely. I mean, if you can have somebody with you, the first 2 weeks are going to be key. That's when you as the patient are going to learn your way around your own house, learn how to get up and walk around without much assistance. And then also it's kind of important to get to those first 2 post-ops. So if it's the right foot, I would not advise driving. The car insurance companies will not like that if you do get in a car accident. So if it is the right foot, you will need someone to take you to the post-op appointments unless you take an Uber, but it is good to have somebody around the house. Is it necessary? No. Is it a benefit? Absolutely.
Great, thank you. Another question that has come up is, if I have a hammer toe, can I have that corrected at the same time as the Lapiplasty procedure too?
Yes. Yep, that's it. Just yes.
Great, thank you. Another question that has come through is there any way to correct a bunion without undergoing?
Sorry, say that again?
Is there any way to correct a bunion without having to undergo surgery?
To correct a bunion, no, but there's plenty of ways to manage a bunion. You know, those non-operative conservative measures, they manage the symptoms of the bunion. However, as we previously stated, your genetics and biomechanics are typically what influence the bunion formation. Once the bunion is present, it does not reverse. It typically just either progresses or it progresses, or it kind of just stays there until you just deal with it, right? I do have patients that have developed bunions that learn how to manage them and don't need surgery, but they don't go away. The bunion doesn't go away. They just learn to live with it.
Great, thank you. Regarding regarding anesthesia, what type of anesthesia is used for this specific procedure?
Yeah, so more often than not, it's called MAC or TIVA or Twilight, similar to a colonoscopy. I prefer my patients not to have to be intubated, but again, that's going to be a decision between the anesthesiologist and the patient. Now, I do have the block, that popliteal block or the nerve block performed by anesthesiologists before, so the patient does end up needing less drugs during the surgery, if that makes sense.
Yes. Another question that has come through is, can somebody that is a diabetic have this procedure done?
Absolutely. Now, there are levels to that, right? So I advise my diabetic patients to get their hemoglobin A1C under 7, right? I prefer it under 6, which some people would tell me that's not a diabetic anymore. But I would advise that the hemoglobin A1C is as close to 6 as possible. There are studies that demonstrate higher rates of complication in terms of wound healing and bone healing when the hemoglobin A1C is higher than 7.
So if a patient was to have several different health issues, could the patient still have this procedure done?
Potentially. That is a hard question to answer, simply because they can have a lot of things, right? But I will tell you, more often than not, the patient that has a bunch or a long list of comorbidities would not likely be a patient or a candidate for fusion surgery. At the end of the day, Lapiplasty is a fusion of the tarsometatarsal joint, which requires optimal healing both from the bone and the soft tissues.
Great, thank you. Another question that's come through is, I'm currently taking a weight loss drug. Do I need to stop taking this drug to have the procedure, or can I still take it and undergo the Lapiplasty procedure?
Yeah, that's actually been quite the hot question lately. So our practice has recommended that the patient stop the weight loss drug approximately 7 to 10 days prior to surgery and can resume about 7 to 10 days after surgery.
Great, thank you. Another question is, if I smoke, will that prohibit me from being a candidate for this procedure?
No, smoking doesn't prohibit you, but it does put you at a risk for wound healing and bone healing complications. Again, I would advise evaluation by a Lapiplasty trained surgeon to see if you're a candidate, but being a smoker is not an absolute contraindication for Lapiplasty, and there are newer generations of Lapiplasty, including the microplasty, that allow for smaller incisions to perform the same procedure, which would limit the potential wound healing complications.
Can you comment on a patient who has osteoarthritis? Can this person still undergo the Lapiplasty procedure?
Yeah, it depends, right? So most patients that do undergo Lapiplasty have osteoarthritis, but not at the big toe joint. They typically have a bump in the middle of their foot or on the side of the midfoot, right? Not by the big toe joint. And that's where the arthritis is. As I mentioned before, if there's significant arthritis at the big toe joint, that patient may no longer be a candidate for bunion surgery and may indeed need a fusion of the big toe joint. Again, this will be a discussion between you and your surgeon, so I advise evaluation by a podiatrist or Lapiplasty trained surgeon.
Great, thank you. Going back to talking about the Lapiplasty procedure, how long does the procedure typically take?
Yeah, so the procedure in and of itself typically takes anywhere from 45 to 90 minutes, depending upon severity and any ancillary procedures. The patient is wheeled from the operating room to the PACU or the recovery room, where they are monitored by the nurses. And typically from the time that the patient goes back to the operating room to the time that they are wheeled out the front door to go home, it's about 3 hours. Yeah, not too long.
Post-operation, how does a patient bathe or shower?
Yeah, so I get that question probably multiple times from the same patient, multiple days, because it's quite difficult, right? The biggest risk, of course, is to the skin, and we want to keep that dressing dry. So I tell my patients to take a towel, fold it into thirds long ways, wrap that towel around their thigh, and then a garbage bag goes over the foot, up the leg, and then taped onto the towel. That way, if any water does come down, it is caught by the towel. I do have patients that get those shower sleeves offline, or simply just stick their foot out the tub. But those are the main ways that I've heard of patients keeping their Lapiplasty procedure dry.
Great, thank you. Another question that has come through is, I have a job that requires me to be on my feet all day. How soon can I return to work?
Requires you to be on your foot all day. I'll answer that in 2 questions. If you have to be on your foot all day without carrying things, you could probably go back to work in about 90 days. That's the soonest I would advise if you have to stand all day. If you have to carry things, I would probably add another 2 weeks to a month on top of that.
Great, thank you. Another question that's come through is, will I be able to wear regular shoes and sneakers again?
Say that again?
After having the Lapiplasty procedure done, will I be able to wear regular shoes and sneakers again?
If you're asking if you can wear the same shoes you had before, yes. But if you're asking if you can wear a 4-inch or 5-inch stiletto pump that you couldn't wear before, and that's what you're defining as a regular shoe, then no, right? Because we're aligning the big toe joint and we're preserving or restoring the anatomy of the first ray. So can you wear those shoes? Sure. But would I advise it? Likely not, because I wouldn't want a recurrence or some development of pain at the big toe joint after my Lapiplasty procedure. But have I had patients wear quote unquote regular shoes, which turned out to be high heels after Lapiplasty? Yeah, absolutely. And they have no pain. So it's really going to depend on you, your surgeon, and your recovery.
Got it. Another question that has come through is, if a patient is on blood thinners, do you recommend that they stop taking the blood thinners prior to the procedure and after the procedure?
Yes. So The specific blood thinner is going to have to be a discussion with your doctor. They'll have their own protocol, as well as a discussion with your hematologist or cardiologist regarding cessation of anticoagulation therapy or blood thinners before surgery. We would always advise resumption of those blood thinners after surgery, and that's going to be a discussion again between you and your surgeon.
Great, thank you. Can you perform a Lapiplasty procedure to correct a Taylor's bunion?
No, so typically we do not perform Lapiplasty on Taylor's bunions. The bunionette, or the bunion by the fifth toe or the pinky toe, is most commonly managed with a simple osteotomy and may or may not require fixation such as a screw or a pin.
Regarding the hardware for the Lapiplasty procedure, does it need to be removed at any point?
Potentially. So in orthopedic surgery, we remove the implants approximately 3% of the time. Now, in my practice, we remove hardware if there is some sort of neuritis, if there is rubbing of the hardware onto the skin, if the patient is unhappy with the hardware in there because it's affecting their shoes, or if the patient is having a reaction to the hardware. But typically, no. A majority of the patients keep the Lapiplasty hardware in there for entirety.
Great, thank you. We've had a couple people ask about other options besides surgery if they aren't necessarily ready to dive right into the Lapiplasty procedure. What do you recommend can help alleviate the pain that their bunions are causing them?
So I think it's important, and I tell this to all my patients, it's important to determine if you're having pain on the side of your foot, of the big toe joint, on the bump, or if you're having pain in the joint, right? If you're having bump pain, you can try and get a bigger shoe. And if the pain goes away, then you solved your issue. But if you're having joint pain, that's a different story. And conservative measures, for that true bunion deformity, are going to be a stiffer shoe, potentially an orthotic. But again, you want to be evaluated because the longer you wait, the higher chance of developing arthritis at the big toe joint, to the point where you're no longer a candidate for bunion surgery. So you kind of want to get in there sooner rather than later to at least get evaluated. You don't have to commit to any kind of procedures, but you definitely want to be evaluated by a surgeon so that you can get a prognosis of what's going to happen to your foot in the future.
Great, thank you. Regarding the cosmetic appearance of your foot post-surgery, will I have a scar? And if so, how big will the scar be?
Yeah, so this is a very big passion of mine. I was trained by plastic surgeons. I use plastic surgery techniques in my practice, and I'm very, very picky about how my scars recover, because that scar on the top of your foot, as you can imagine, is right where the shoes touch. So will you have a scar? The answer is yes. How big of a scar? It depends on your surgeon, their tissue technique, and you as the patient and your healing potential. There are ancillary procedures or treatments that can help manage that, such as creams and laser, or even physical therapy. But yes, you will develop a scar, just like anytime you cut skin, especially when it's full depth.
Great, thank you. I know we touched briefly a little bit on different types of occupations and people that may be on their feet for most days during the day of their workday. Can you kind of describe what you would say, how long a patient would be off work for a sedentary job?
Yeah, so for a sedentary job or somebody that works in an office, if they are allowed to return to work with a knee scooter or a walker or crutches, I will allow my patients to go back to work at about 2 weeks once the skin is closed. So I don't need them to be off of their foot completely, especially once they're in that walking boot, because they are protected. But I just do advise that the foot gets elevated through the day if possible. And as long as your employer allows you to work with a knee scooter or crutches or a walker, you can go back to work at 2 weeks.
Great, thank you. Another question that has come through is, I know we talked about this a little bit briefly, but what is the age requirement for this procedure to be done? For example, can this procedure be done on a 16-year-old?
I have seen them done. Let me check something really quick. If we have that, I believe so, but don't quote me regarding what the FDA has cleared Lapiplasty for. Pediatric. That being said, it's difficult for me to advise any sort of fusion surgery on a patient under 18. There are the few cases where the patient does have a large bunion deformity, and it's something that may want to be addressed, but those are less common in my practice, and I typically advise the parents having the patients wait until at least 18 when the growth plates are closed. Again, if that's a 16-year-old with the closed growth plates on X-ray, I feel a little bit more comfortable in a 16-year-old with an open growth plate.
Great, thank you. Another question that has come through is, in your experience, have patients commented on change in their walking or running gait? What type of comments have there been on how foot movement has changed post-Lapiplasty procedure?
Yeah, so it's very important to understand that this is a fusion surgery. So patients typically will experience a little bit stiffer midfoot. So in walking and even jogging, you kind of don't really see that, but this comes into play on uneven surfaces and kind of running on uneven surfaces where the foot has to adapt to that uneven or non-flat surface. So that's kind of the main comment that I get, but I will tell you those patients that undergo Lapiplasty and are very athletic, they usually have pain right at that spot, and that's what's pushed them to come to surgery. So after the surgery, that pain goes away, but the foot is somewhat more rigid than prior to surgery.
Great, thank you. I know we talked about this a little bit earlier on during the presentation, but can you highlight the Lapiplasty procedure recovery again, just kind of outlining those first 2 weeks into the first month, into the next couple of months?
Can you say that again? Sorry, I wasn't tracking.
Yeah, of course. Can you please highlight the Lapiplasty procedure recovery again?
Yeah, sure. So the first phase, 1 to 2 weeks, is the skin phase. We want the skin to heal. So you're going to be non-weight bearing, ice, elevate, try not to keep that foot down to limit the swelling. You're going to do either 1 or 2 post-op visits. Once the surgeon determines that the skin is nice and closed, we'll put you into a walking boot. That is for 4 to 6 weeks, up to 8 weeks. And that will take you to approximately the 1.5 to 2 month point after surgery. At this point, 6 to 8 weeks after surgery, the fusion is more present and likely seen on X-ray. The patients will be then transferred into a sneaker at that 2-month point, and they will sequentially or slowly increase activity to either running or high impact activity, starting at 4 months and gradually increasing to full high impact activity at 6 months.
Great, thank you. Going back to the age requirements, we've had a lot of questions come in toward the end about, is there an age that is too old to get this procedure done?
No. There's not an age that is too old, right? It's quite funny you say that because I have extremely healthy 80-year-old patients and I've had extremely unhealthy 40-year-old patients. So a patient is not a number. They need to be evaluated in totality to include their current physical level, activity level, and anticipated activity level going forward. So no, there is not an upper limit in terms of age, but again, I advise evaluation by a Lapiplasty trained surgeon to see if you are indeed a candidate.
Great. Thank you, Dr. Dublon. We have time for a couple of more questions. Another question that has come through is, if my doctor is not a Lapiplasty trained surgeon, can he discern whether the procedure is a right fit for me, or should I seek the advice of a Lapiplasty surgeon?
You know, that's going to depend on your relationship with that doctor. My advice and my recommendation always is to find a surgeon who is trained by Lapiplasty, but more importantly has done a few of them. You know, the beauty of the Lapiplasty Find a Surgeon website is that you can see who's done a lot in your area, who's done a few, and you want to be able to get a couple of opinions whenever you get surgery, obviously. But you want to get the opinion of somebody who's done quite a few, or at least more than a couple, so that you can get an idea of whether or not you are indeed a candidate for that surgery. It's very difficult for a surgeon that doesn't perform a procedure to tell you if you're a candidate or not for a procedure that he doesn't or she doesn't do.
Great, thank you. So if a patient were to be interested in learning more information about the Lapiplasty procedure, how would they go about finding more information or scheduling a consultation to get more information?
Yeah, so the Lapiplasty website is great. I mean, there's a ton of patient education resources, but more importantly than not, there is the surgeon locator on the page. You can put in your zip code and the radius that you're willing to travel. And on there, there's the contact information. And I believe there may be, you can correct me if I'm wrong, I believe there may be a button to email the practice. So you can get in touch with that practice directly to try and schedule an appointment. But that would be the easiest way to get in touch with a Lapiplasty trained surgeon, is through the surgeon locator at www.lapiplasty.com.
Great. Thank you so much for answering that. It kind of goes into my next question of, if a patient is interested in setting up an appointment, how can they request an appointment?
Yeah, so like I said, I haven't been on the surgeon locator for a while, but the contact information for each of those doctors within your area is there. I mean, quite simply, you can just find that doctor through any major search engine, but Kendall, do you know if they can reach out directly to the practice website through the surgeon locator?
I do not believe so, but the number and the address of that doctor's location would be listed under their profile, so they would be able to do a quick Google search and be able to find that practice number and get in touch with the correct personnel.
Yeah, so I'm not sure if you know, Kendall, but I think they are working on something like that to be able to reach out and touch one of the emails at the practice. But as of now, I do believe the patients have to go and engage the practice directly. But all of the surgeons' information is available on the surgeon locator at lapiplasty.com.
Yep, that sounds about right. All right. So as we begin to wrap up now, if your question did not get answered, or you think of something later that you wish you had asked, feel free to reach out to us. Our email address is patientinfo@treece.net. That is patientinfo@treece, TREACE.net. You can also learn more or find a local doctor by visiting our patient website, www.lapiplasty.com. Don't forget that as a follow-up, we will email all registrants an archived webinar link for reference. We hope you found the information presented tonight helpful. Dr. Dublon and I appreciate you joining us. I hope you all have a wonderful rest of your evening. Thank you.